Piles or hemorrhoids, they're super common, right? But it's definitely a topic we tend to shy away from. Well, in this explainer, we're going to change that. We are going to break down exactly what they are, what causes them, and most importantly, what you can do to manage them. So, what are we even talking about here? Well, when you get right down to it, the definition is actually pretty simple. You've heard of varicose veins, right? Just imagine those, but in a very specific spot: the lower rectum and anus. It's that swelling of the veins that causes all the trouble we're about to get into. And what's really interesting is that not all piles are the same. They're basically split into two types, and it all comes down to one simple thing: location. Internal ones, well, they're inside the rectum, so you usually can't see or feel them. External ones, on the other hand, form right under the skin around the anus, which makes them a lot more obvious. Okay, so how would you even know if you might have them? Catching the early warning signs is absolutely key. So let's just walk through the most common things to look out for. There are really 5 main signs to be aware of. One of the most common is seeing some bright red blood after you go to the bathroom. Other big ones are itching, just general pain or discomfort, especially when you're sitting down, or noticing some swelling or even sensitive lumps around that area. Understanding the symptoms, well, that leads us right to the next big question, doesn't it? Why? Why do piles develop in the first place? What's really going on inside the body that causes all this? So let's dig into those contributing factors. And as you're about to see, it pretty much all boils down to one simple word: pressure. The causes can seem pretty varied, but they all share that one common theme. They increase pressure on the veins in your lower rectum. Things like straining because of constipation, not getting enough fiber in your diet, sitting for really long periods, or the extra weight from obesity or pregnancy, all of them ramp up that internal pressure. Even just getting older contributes because, our body's tissues naturally get a little less supportive over time. Now, that might seem like a long list, but here is the good news. Understanding what causes them points us directly to the solutions. The real key to managing and preventing piles, it isn't some big, complicated secret. It's actually found in our everyday habits. All right, this is probably the most important part of our whole explainer. Let's get into the practical, everyday steps you can actually take for both relief and prevention. First up, and honestly, this is probably the biggest game changer, your diet. A high-fiber diet is just crucial. Adding more fruits, veggies, and whole grains into your meals helps soften things up. And that means less straining, which directly reduces that pressure we've been talking about. And going hand in hand with fiber is hydration. Fiber works best when it can absorb water, so drinking plenty of fluids, especially water, throughout the day is absolutely essential to keep everything moving along smoothly and help prevent constipation. Next up, movement. I'm not talking about running a marathon here. Regular, moderate exercise like a brisk walk, a swim, or some yoga doesn't just help your overall health. It specifically improves your digestion and circulation, which can seriously reduce that pressure on the rectal veins. For anybody who has a desk job, listen up, because this is a big one. Sitting for hours on end puts constant pressure on that area. The solution is so simple. Just make it a habit to take short breaks. Get up, stretch, walk around for a minute or two every hour. It makes a huge difference. This one is all about listening to your body. When you feel the urge to go, just go. Don't delay it. Holding it in can just make constipation worse. And when you are there, try to avoid straining or spending way too much time on the toilet. And finally, a quick and simple tip on hygiene. Just keeping the area clean and dry can really help soothe any irritation. Using gentle methods, like maybe wet wipes instead of dry toilet paper, can make a real difference in how you feel. Now, these lifestyle changes, they're the foundation. But the source material we're looking at also touches on an alternative approach. So, to be thorough, let's take an impartial look at the homeopathic remedies that it brings up. The thing about the homeopathic approach is that it's highly individualized. It is definitely not a one-size-fits-all method. Specific remedies are suggested for very specific combinations of symptoms. For example, the source might suggest Aesculus for someone who has non-bleeding piles and backache, but then suggest something totally different like Hammermalice for a case that involves bleeding and soreness. And this brings us to a really crucial point from the source material itself. It includes a very clear disclaimer which says, and I'm quoting here, "It's essential to consult a qualified homeopathic practitioner for personalized advice." This really highlights the idea that these are not treatments you should be prescribing for yourself. So, what's the most important thing to take away from all this? It's this. While piles can be uncomfortable and, yeah, disruptive, they are highly manageable. The power to find relief and to prevent them from coming back lies right there in your proactive, consistent lifestyle choices. And that really brings us to the end. So, as you think about everything we've just covered, from diet and water to just getting up and moving around, I'll leave you with one final thought to consider. Based on what you've just learned, what's one small, totally manageable change you could start making today?